Can you easily classify skeletal system joints? Have you ever wondered how the joints in your body are organized? Understanding joint classification can help us appreciate how our skeletal system supports movement and stability. Let's break it down. Skeletal system joints can be classified using two main approaches: structural classification and functional classification. Structurally, joints are grouped based on the type of tissue connecting the bones and whether a joint cavity is present. First, we have fibrous joints. These joints connect bones using fibrous connective tissue and do not have a joint cavity. They usually allow little to no movement. A couple of examples include the sutures in the skull and the connection between the tibia and fibula. Next, we have cartilaginous joints. These joints connect bones through cartilage, either hyaline cartilage or fibrocartilage, and also lack a joint cavity. They allow for limited movement. The intervertebral discs in your spine and the pubic symphysis are great examples of cartilaginous joints. Finally, we have synovial joints. These joints feature a fluid-filled cavity between the bones, allowing for a wide range of movement. They are the most common and movable joints in the body. Think about your knee, elbow, shoulder, and hip joints. Now let's look at functional classification, which focuses on the range of motion. Synarthroses are immovable joints, like the sutures in your skull. Amphiarthroses are slightly movable joints, such as the joint between the tibia and fibula. Diarthroses are freely movable joints, primarily synovial joints. Synovial joints can be further categorized based on the type of movement they allow. Hinge joints permit movement in one axis, like your elbow and knee. Pivot joints allow rotational movement around a single axis. Then we have condyloid joints, which permit movement in two directions, like the knuckle joints. Saddle joints allow for greater freedom of movement, such as the thumb joint, which enables you to grasp objects. Ball and socket joints, like those in your shoulder and hip, allow movement in multiple directions. Lastly, planar joints permit sliding or gliding movements, like those between the carpal bones in your wrist. This classification system provides a clear way to understand the joints in the skeletal system by their structure and function. It helps explain how different joints contribute to our overall mobility and support. Understanding these classifications is essential for studying joint mechanics, injury mechanisms, and treatment approaches.